For the first time, a health emergency has been declared in this country because of the Zika virus, which is suspected of causing birth defects. The governor of Florida put the emergency into effect in 4 counties, including Miami-Dade. It will allow more spraying for mosquitoes that can spread the disease. Zika can also be transmitted sexually. Florida has at least 9 cases. All of the patients were infected overseas, but now there's concern that those patients could infect Florida mosquitoes. So far, there are 48 patients in 12 states and Washington, D.C., all infected overseas except for 1 sexually transmitted case in Dallas. Now, all week this week, our Dr. Jon LaPook has been covering Zika at the place that the outbreak is at its worst, in Brazil. Jon, you've been working on why Florida is taking this action. What have you learned?
Scott, I think it's an attempt to stay ahead of the problem by lowering the odds that Zika virus will enter the local mosquito population in Florida. So far, there's no evidence that those mosquitoes have the Zika virus, but here's how it could happen. A person gets infected with Zika virus in Brazil, comes up to the United States, flies into Florida. Now, it stays in the bloodstream for a week or maybe longer. So a local mosquito in Florida bites that infected person, picks up the virus, turns around and bites an uninfected person. Now you've got local spread of the Zika virus, something that they definitely don't want.
Well, Jon, nobody has more experience dealing with this than the Brazilians. What are they doing there that we might see here later?
Scott, it's an all-out effort here. I mean, first they're doing public spraying. They're trying to reduce the mosquito breeding grounds, but they're also going house to house. We went with soldiers yesterday, public health officials, door to door, educating people about prevention. Specific things like small containers that contain water can be a breeding ground for this species of mosquito.
You've been talking to a lot of authorities about this. What's the likelihood that there will be a mosquito-borne outbreak in the United States?
Scott, I think it is very, very likely that eventually Zika will make its way into local mosquitoes, probably in the southern part of the United States first. But all the health officials I've spoken to think it's very unlikely you'll have a big outbreak on the scale of something, say, in Brazil.
Dr. Jon LaPook on the front line of the Zika outbreak in Brazil for us tonight. Jon, thanks.